Hello again, I'm Dr. Charlie Schuster. I'm going to be presenting today a little bit about the secrets of the hip. At Back to Health, we deal with a lot of back problems, of course, but also other extremity problems. And what's so important for the proper function of the hip is that we start to think of our bodies more like a computer. And we need the right software. We also need that software to be updated. So when folks come in and they have back problems or hip problems, we teach neuromuscular re-education of the hip. And that's a fancy way of saying we're going to update the software for the hip. This also affects the knee in a very positive way and the back in a very positive way. And of course, all of this helps the nervous system. That's what we're really here for, because that nervous system runs everything. So we're going to start with putting the proper software in place. I like kettlebells, and we want to get the cross crawl reflex back in place. If you don't have a kettlebell, no big deal. We can work with a set of hand weights or a barbell. But what we want is we want your shoulder to drop in, keep it straight. We want it to compress the shoulder, and we want to be able to rotate not the wrist, but the arm as a whole, the shoulder in and out, with some weight on the shoulder. Now I'm going to use a kettlebell because it just stays right next to the arm. We get that great compression into the shoulder, which by the way is very therapeutic for the shoulder. And then we're going to go ahead and raise the opposite leg. And if you note about how high I'm bringing my leg right now, that really is as high as it goes. And I'm going to rotate in and out 10 times. 2, 3, 4. If you'll notice, 5. As I rotate my hip in, I'm rotating my shoulder in. As I rotate my hip out, I'm rotating my shoulder out. And I'm emphasizing that rotational movement in the hip, in and out, and coordinating. And as I get to 10 and 10, I'm done. Now, if I break a second, this is one of the most incredible ways to increase flexibility of the hamstring, which is so important for hip but also back. Without doing any stretching here, but rather updating the software, I should be able to take my hamstring a little further. And that will happen, and it will amaze you when it does. So that's the first thing, is I want to loosen my hamstrings. Notice how I didn't just drop down to stretch. That's primitive. We've got to get a lot more evolved when it comes to exercise. So we are priming the software. Again, I'm going to go to this side now. Same thing. Bring the leg up, and I'm going to rotate in and out, both in, both out. If this doesn't come real easy for you, just remember you've got to crawl before you can walk, before you can run. Just do it real slow, but it'll be like riding a bike, because this is a normal, natural reaction that you, chances are, just programmed out of your normal movement. So again, way better than just stretching, which we'll get to that, is getting these guys coordinated. So now, again, we should see a lot more mobility in the hamstring, and I can really tell a difference there. You'll have to do this to appreciate it yourselves. So the first thing we did is we primed the nervous system. Now, one of the most important reasons for doing this is we actually want to turn the G medius muscle back on. The G medius muscle, we talk about when you sit, how that glute muscle just turns off on us. And when that happens, and then we get up to go to walk, the most stabilizing muscle for our pelvis isn't kicked in. So it's not going to stabilize the hip. So if your hip isn't stable, your back muscles and hamstrings kick in to stabilize, and they're not very good at it. They really stink. So we want the G medius muscle to fire when you walk, so that you're not constantly using your back muscles and hamstrings incorrectly, because all the stretching in the world is only going to prep you for getting up and doing it wrong again if we don't get this G medius muscle, that middle glute muscle, firing, because it's the #1 stabilizer of the pelvis. So what we want to do to get that guy firing is we want to lay back and do just a single leg lunge. Now, I add a little bit of weight on just because I want to fire those glutes. You don't necessarily have to, but it kind of helps ground your core, which is probably also switched off and needs a little help. So I put that same weight that I've used previously right on my pelvis. And I'm going to work on my right glute first, so I'll raise the leg up. In fact, I'm going to work on my left one just so you can see the firing a little easier from this angle. And I'm going to go up and down. Now notice I'm not bridging and purposefully arching my back and going up real high. I'm just trying to fire that glute muscle. I'm on 5. And I'm still not feeling it in my hamstring, which is good. 6, 7, 8, and 9, and now around 10 I'm starting to feel like I'm recruiting my hamstring, and that's no good. I just want to fire the glute. So if I get to 8 and I'm firing my hamstring, done. Because again, the primary thing here is to teach our nervous system to fire the glute muscle, not the hams, not the low back. So if you only get to 2 or 3, go ahead and just do 2 or 3. If you get to that 4th and you feel your hamstring, you're done. You're done. It'll get better. And we've got something that'll supersize or kind of speed that up for you. Another neurological exercise for that G medius muscle. So if you do that on both sides, we just do 10. The idea here is really not to strengthen the G medius. It's just to get the brain talking to it so that it's firing. And 7 and 8 and 9, starting to feel it in that hamstring right there at 10. Done. Good enough. And so that's enough to get that G medius firing. That is what we want to do to turn on those glute muscles and start the process for any exercise we would do for the hip and also for the knee. And so I just want to show that because it's one of the most important things. Now, to do all this and have your G medius muscle firing now, while you're on the ground, wouldn't it make sense to just go ahead and try to get your lower core muscles to wake up too? The lower core muscles always need a tension that helps you support the ligament that runs along the front of the spine. And it really is very important to have this intra-abdominal pressure from your lower core without thinking about it all the time so that your lower back doesn't develop instability because of that ligament not being supported by that pressure. And so it's so important. And our lower core gets switched off just like our glutes when we sit all the time and don't use it. So while you're in this position, go ahead and let's do a proper leg raise. And you just come up as high as you can and then back down. Now, if you happen to notice some popping or clicking when you do this, that is something that your clinician or your physical therapist ought to know about, because instability is a concern. We want to get that movement pattern out of your system, and that's what we specialize in doing, so we can help you with that. But if you could just raise your leg as high as you can and back down 10 times while closing up the gap that naturally forms when you lay on your back, push that down, stabilize your pelvis, and add some motion to it. And if you are clicking, you'll notice if you push down a little more in that area using your lower core, usually that click will go away. So it's a great thing to train to do that. And I can tell you from first-hand basis, I've had left hip issues, and I've totally corrected them. It's amazing what this little routine will do for you. And we'll do it 10 times on the other side. I'm just leading you through my daily routine right now, but in smaller segments. And this is all part of switching on the muscles of the lower back. And we'll just call this secrets of the hip and knee, but I will tell you it's obviously going to benefit that low back immensely. So we'll do that 10 times. Awesome. That concludes the preparatory work for the hip and knee. The next little segment I'm going to do will be a stabilization and continue to work the glute in a way that we continue to improve that communication between the midbrain nervous system and the middle gluteal muscle. So that's what we're going to do for this segment, and we'll pick up here with our next segment on knee stabilization. So tune back in.